Hi, my name is Jody Clem. I am a student at Western Governors University, and my presentation is Early Stage Breast Cancer, Individually Tailored Treatments. Just about a decade ago, oncologists commonly endorsed chemotherapy for all patients with early stage breast cancer. With the dawn of gene expression profiles from breast tissue to determine its resistance or response to chemotherapy, nearly 50% of patients with newly diagnosed breast cancers do not need conventional chemotherapy. Rather, they opt for a less toxic treatment called targeted drug therapy. Research suggests that less treatment for some types of breast cancer benefits patients because it can improve outcomes and it spares the patient the harmful side effects of chemotherapy. Chemotherapy drugs are powerful chemicals that kill rapidly growing cancer cells. Unfortunately, they cannot differentiate between normal cells and cancer cells. As such, according to the Marshfield Clinic, these chemicals do harm perfectly healthy cells, which causes the side effects of chemotherapy. The visual aid that I'd like to show you here is an example of an Oncotype DX score from Genomic Health Incorporated. The Oncotype DX is a report for breast cancer and many other types of cancer, but for today's presentation, I'm using it in the context of breast cancer. Please note that the score on the patient's report here is 10. It's circled with a 10. According to Genomic Health, based on this Oncotype DX scoring scheme, this low score would not necessitate chemotherapy. The Oncotype DX scoring system uses a score system from 0 to 100. Between 0 and 20 would not necessitate chemotherapy. Anything above 20 to 100 definitely would need chemotherapy. Sometimes a doctor and a patient, depending on the grade of the tumor and how it looks under a microscope, if it is very slow growing, if it has a score between 20 and 25, they may decide as a team not to move forward with chemotherapy, instead opting for a less toxic treatment. According to breastcancer.org, the Oncotype testing is helpful because it determines a woman's risk of recurrence of early stage estrogen receptor positive breast cancer. It also uses a scoring system as to the likelihood a woman is to benefit from chemotherapy once breast cancer surgery has been done. According to the Seattle Cancer Care Alliance, the less is more approach obliterates cancer cells while improving cure rates and decreases the risk of breast cancer recurrence. Also, according to the Seattle Cancer Care Alliance, about 80% of early breast cancers are estrogen receptor positive. This means that these cancer cells require estrogen in order to grow. As such, this type of breast cancer responds favorably to hormone blocking therapy instead of the customary traditional chemotherapy. Common long-lasting side effects of chemotherapy may include neuropathy, which is numbness and tingling of the fingers and toes, early menopause, and weight gain. Also, long-term side effects are the risk of heart problems and leukemia, which are, though rare, may occur long after chemotherapy is given. Short-term side effects of chemotherapy also include neuropathy and nausea, vomiting, fatigue, and hair loss. This is according to the Susan G. Komen Foundation fact sheet. Hormone therapy, also called endocrine therapy, is a therapy that can reach cancer cells anywhere in the body, even if the cancer has traveled outside the breast to a distant site. According to the American Cancer Society, hormone therapy is exclusively given to women who are hormone receptor positive. Hormone therapy can be given in many different ways, through oral medicine, through subcutaneous shots or pellets, and also through intramuscular injections. It does not cause the side effects that chemotherapy does. The most significant side effect for hormonal therapy is joint pain. In closing, it is clear that research has made significant strides in the treatment of some types of breast cancer. The paradigm has shifted from the old give her all you've got to the new less is more with the dawn of treating patients according to their genetic markers. Chances are you know someone who has been diagnosed with breast cancer. If so, this information is exciting as we have improved our ability to select those who will benefit from chemotherapy and allows us to identify those patients who will not derive any benefit from chemotherapy. In short, we have saved 50% of women diagnosed with estrogen receptor positive early stage breast cancer from suffering the debilitating effects of chemotherapy. Thank you.